Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Sunil Kumar from Apollo Cradle and Children's Hospitals. He's going to talk about breathing difficulties in NICU babies. So stick around until the end and ask us questions if you have any. Doctor, you have the speech.
Network issue.
Wi-Fi connected.
Wait.
Live ఉంటుంది.
మాట్లాడొచ్చు.
Okay. Hello, good afternoon, everyone. I'm Dr. Sunil Kumar, consultant neonatologist and pediatrician working in Apollo Hospitals, Brookfield. So today we'll discuss briefly regarding breathing difficulties in NICU. So today we'll discuss briefly regarding breathing difficulties for a newborn baby. So before going to abnormal breathing, we'll know what is a normal breathing pattern in a newborn. So the total number of breaths in 1 minute for a newborn will be around 40 to 60. And normally many babies will have what we call periodic breathing. So they'll have sharp breaths for 10 to 15 seconds, rapid breaths, and then pause for a few seconds or have slow breathing efforts in the next 10-15 seconds. That is normal in newborn period. This is what we call periodic breathing. And coming to the abnormal breathing, that is breathing difficulties for a newborn, babies will be breathing more than 60 per minute, and babies will have respiratory distress. This is a term in which if babies having any retractions, if baby is putting too much of efforts during breathing, we can see the retractions in the chest. And we can hear a sound what we call grunting. Baby will be making a noise during breathing. And babies will have a discoloration of the skin that happens because of low oxygen in the blood. This is what we call cyanosis. And babies can have apnea. Apnea is cessation of breathing. They'll stop breathing for few seconds. It may last from 15-20 seconds. And babies will have trouble feeding as well during breathing difficulty. So these all put together we term as signs of breathing difficulty or respiratory distress in a newborn. Coming to common reasons for breathing difficulty in NICU. The first common reason is preterm baby. Because of immaturity of the lungs in preterm babies, they will have breathing difficulty. So that happens because of decreased surfactant. That is a liquid that is produced in the lungs, which helps with the breathing. Because of surfactant deficiency, babies can have breathing difficulty. That is what we term as respiratory distress syndrome in a preterm newborn. So preterm is anything less than 37 weeks is a preterm baby. And lesser the gestational age, higher the chances of just breathing difficulty and severity of the breathing difficulty because of RDS. And second common reason, in a term baby, we generally see if baby is delivered by elective LSCS, elective cesarean section, they will have breathing difficulty because of retention of the fluid that is there in before delivery, which may take longer time for the baby to absorb that fluid. So this generally lasts for a few hours to few days, 2-3 days, because babies will take longer time to absorb that liquid in the lungs. And as the name suggests, this is a transient tachypnea in newborn. So transiently it may last for 1 to 3 days and then it will settle. And most commonly seen in less than 38-39 weeks babies who got delivered by elective cesarean section. And third one is in what we call meconium aspiration syndrome. In this condition, baby, because of stress during the delivery, baby will pass motion stool when baby is inside, which then baby will aspirate, goes into the lungs, cause the inflammation, leading to breathing difficulty. This is meconium aspiration syndrome. Meconium is the first stool that baby passes, and because of this aspiration baby can have infection on top of this, blocking this meconium blocking the airways. This can be visualized on an X-ray during investigations. We'll do the blood test to see the infection. We'll get an X-ray. We'll get a blood gas done to see how is the oxygen and carbon dioxide levels. And on X-ray, we'll be able to differentiate between premature lung or transient tachypnea of newborn, or a baby with meconium aspiration syndrome. That is that meconium that baby had aspirated. And the third one can be a maternal infection leading to congenital pneumonia in a baby. So, if mother is having any blood or urine infection, that can lead to infection in the baby. And once the baby is delivered, baby will have this breathing difficulties. We will do the routine blood test and X-ray. We will be able to pick up the infection in the blood and probably in the X-ray also. And the treatment will be accordingly. If it is a congenital pneumonia, we'll be giving antibiotics. And if it is a preterm baby because of immaturity, then we'll give surfactant, a liquid, which will increase the lung maturity so that the breathing difficulty is settled. And coming to the part of transient tachypnea of newborn, so most of the time the treatment will be giving the supportive oxygenation, which will help with the which can be done by HFNC, what we call heated humidified high flow nasal cannula, or CPAP, a machine which gives constant pressure during the breathing, or sometimes even we'll have to ventilate the baby. And in a baby with maternal meconium aspiration syndrome, if baby is having any septic markers, we'll have to start off antibiotics, and we'll have to give the respiratory support according to the need of the baby by high flow nasal cannula, or CPAP, or mechanical ventilation, depending on the breathing difficulty. And some babies born with some cardiac problems can have can present with this breathing difficulty. Cardiac problems can be patent ductus arteriosus, PDA, what we call, or complex cardiac problems as well. But complex cardiac problems, the management will be different. It will need a cardiac setup, cardiologist, echo, and all other tests, and managed accordingly with the medical or surgical treatment if needed. And evaluation in the cardiac cases, we'll have to get an echo, and we'll have to consult a cardiologist and see if it can be managed by medical treatment. If PDA, whether we need to give any medications to help close the hole in the heart, or we need to just give oxygen support and other medicines to help with the breathing. If needed, then we'll have to go for surgical consult as well, cardiac surgical consult. And general management depends on the breathing difficulty of a baby. So if a baby is having mild breathing difficulty, then we can, and not much signs of any distress, any infection in the X-ray, just simple oxygen support should be enough. If baby is having any infection, antibiotics, and depending on the breathing difficulty, we'll have to go for oxygen with nasal cannula. Less likely we use generally either HFNC or CPAP, or even ventilation. And if a baby is having suspicion of infection leading to the breathing difficulty, we'll have to go for antibiotics. And if needed for a preterm baby, that's surfactant liquid, which will help in increasing the breathing, which will decrease the breathing difficulty by improving the oxygenation. So these are few of the problems which can cause a breathing difficulty in a newborn period. Thank you.